live here on your screen in just a second. It's kind of buffering. Um, okay, let's see. I'm checking here to see. And it says it. All right, I think we're live. So I'm going to check our
Okay.
page over here to make sure to keep it up. How many of these have you done? Have you done a lot of the Zoom calls and everything?
Yeah. We a lot of just like you said, a lot of people are working from home, so all our stuff's been virtual
I know.
as well. So
Yeah. Which at first I wasn't like loving, and now I'm back in the office and I'm like, oh man, I really liked that virtual there for a while. Everything. But
right.
okay. All right. It appears we are live. Of course, it's like frozen on a picture over here. Okay. So thank you so much for joining us today. You are on our Schuler Bauer Real Estate page, and we have Dr. Eric Yazel. How do you say it right? Did I say it right?
Hazel,
Hazel.
like Hazel with a Y is what I tell
Hazel with
everybody.
what? Okay, perfect. And I just wanted, you are a very popular man these days. And we want to just talk. We thank you so much for coming on here, but we want to just chat about what's happening in our local community. And first, let's just start with a little introduction. So tell us a little bit about yourself and what your role is in the community.
Sure. Yeah, I'm the Clark County Health Officer, and a lot of people don't know what the health department does. It's probably more than you think. Obviously we've been around a lot for the COVID stuff, but we do a lot of routine stuff too, environmental stuff, restaurant inspections, pool inspections, things like that, mosquito spraying. We have our public health nurses that do immunizations. We just do a lot of different stuff, but obviously any kind of public health emergency falls under our duties, and so we've been busy there. And then I'm an ER doctor in the county as well at Clark Memorial and over at U of L, so also to do some of this stuff firsthand as well. So pretty busy these days, but
Like,
hanging in there.
I'm pretty sure, yeah. So, like, some of the things that we've kind of been talking about that I guess I didn't realize fell into your category is like all the HOAs and the pools opening now with the different
Mhm.
COVID restrictions. So, I didn't know that you guys kind of are the ones helping us mandate those rules, and then restaurants and things. So, yeah, you have been very busy. Um, so, how has life been changed in the last 30 to 60 days, I guess, since the whole March, I guess, what was it, March 9th, March 12th is when we went into quarantine. So,
Yeah, I know. My birthday was March 14th, and we went out to like a small little dinner, and we kind of knew that was going to be the last hurrah. So we knew that yeah, everything's been pretty different since then, and
yeah,
yeah, it's been wild. I mean, just like you said, we've all learned how to kind of work from home, and we've had a lot of these virtual meetings and things like that. And that was the thing, is we're trying to communicate, coordinate the whole COVID response for the county. And normally there'd be meeting after meeting of all of us in the same room, and just trying to figure out how to do that remotely. Was our first challenge. So.
yeah. And I want to say, like, kudos to you guys because you all did a phenomenal job. I think everyone in the community really did, stepping up and abiding by the quarantine rules and the social distancing. And I think even like with restaurants shutting down, everybody's just done a really good job. So, what do you think as the COVID-19 pandemic continues? How do you think we're looking in the next couple of months? Things that are happening? Are you seeing restaurants are back open at the 50% from the governor's orders? There's other businesses that are open. Are you seeing spikes in cases? What are you guys kind of seeing there?
Yeah, it's we've been watching really carefully as we kind of navigated through the reopening process, and actually, not at all. We're not seeing any kind of spike. In fact, our numbers continue to decline. And what I tell everybody to look for is not the actual, like, Clark County had 10 cases today. I tell everybody to look for what percent of people who were tested positive, and that's continued to go down. We've gone, actually, since we've reopened, we've gone down 3 to 4% on how the percent of people who are tested positive. So really hasn't been a spike at all. Like you said, the businesses and restaurants and stuff have been awesome on working with us and putting safety first and stuff. So we've been really fortunate around here. Because I know I've got some people that I know in other parts of the state and country that have some real headaches, and we've been pretty blessed around here as a community. So.
Okay, good. Well, that's good information. So, like, what do you think this is just the new normal? Is the new normal can't kind of like I'm gonna go everywhere with a little bit of a mask and hand sanitizer, and that's just how it's gonna be?
I think, it's gradually going to go back similar to what we knew before, but an awareness anytime you're in a big crowd, especially for like the older population and those who are on like immunosuppressant drugs and things like that. I think that's always going to be now in the back of our minds. I think everybody's going to have a mask, whether it's in their glove box, purse, anything like that. That's always going to be a thing and always going to be something that we kind of live with now. Do I think we're going to be masking up all the time? No. I think as our numbers continue to get better and hopefully this phases out, then I don't think it'll be quite as intrusive in our everyday lives, but it's probably always going to be something that's a factor for us.
Yeah, I know. I'm kind of looking to see, like, are we going to have a Kentucky Derby? Are we not going to have a Kentucky Derby? Fingers crossed for some. I'm ready. I saw a meme on like Facebook today or something. It was like, I'm ready to pay for an overpriced beer at a concert to do something to get out of the house to do. So how are the hospitals? You said you're an ER doctor there. So like, how are they? Are they still lots of people still coming in? I know I recently had an emergency where we had to go to the ER and it was dead. No one was there.
Yeah.
Yeah,
it was kind of an interesting time that way too. We're seeing the same thing. The COVID admissions are way down. We only have a handful of patients in the hospital right now with it, and so it's improving. But yeah, during the peak of the stay at home and the pandemic, our ER volumes were down like 35-40%, and we actually were at first we wanted to tell everybody, hey, stay home for the non-emergent stuff so we can take care of all these COVID patients. And then after a few weeks and nobody was coming in, we're like, well, wait a second. Like, I know you guys are still having heart attacks and stuff. Like, you need to come in here if you're sick, just don't come in here for dumb stuff. Stay home
for that.
Yeah. So we actually got really concerned because, we're like, are people staying home when they really need to be here? And, we just wanted the minor stuff that could be seen by a family doctor or urgent care. We wanted that stuff to stay home so we could focus on the really sick people. But it was almost like everybody listened too well. So we were actually concerned. Yeah.
Everybody did very good in the community. Kudos to everyone because they did listen. So that was great. So there are testing sites out there now because when this first broke out, there were not very many tests available. So now what is the status of testing sites? If you do somewhat have the symptoms, there are locations throughout the county that people could go to, correct?
Correct. Yeah, that was our biggest challenge when it first started out, was just finding the way to test people. And it was, the state was really restrictive on who got the test, and rightfully so, because they could only run like a certain number each day. I mean, there was a time where the whole nation could only run it was like a couple thousand tests a day. I mean, it was crazy initially. Like, we really had trouble ramping up that ability. It's a total different ball game now. We have about 7 different testing sites in the county, and we have a state-sponsored one at the Clarksville Community Center. You can get in and out of there in 7 minutes is what their average time is. It's free. You get your results back in about 48 hours. So it's just a really nice setup, and it's been one of the busier ones in the state, which is great. That shows that people are utilizing it, because that helps us help you as an individual, but also getting a nice sample size of the whole community helps us make some of these reopening decisions too.
Yeah. And so is there any misinformation or anything that you would like to address while we're kind of chatting about this, about the COVID-19?
The one thing I would probably say is just to try kind of find a middle ground with this. It seems like everybody wants to get in 2 corners. Like, this is just a big hoax and there's nothing to worry about, or this is, the worst thing ever and we can never come out of our houses. Just, kind of just give it, I always say, respect it, but don't fear it. Follow the recommendations. The state plan has actually been excellent so far. It's been really safe, data-driven, stepwise approach. So, does the media over dramatize COVID? Absolutely, just like they do a lot of other things. But it is a very real thing as well. Like, I just had a friend who lost her father to COVID. This is still a big deal, and especially for like our older population and nursing homes. If we don't respect this and open up in a responsible fashion, we're still putting them at risk. And so, it's like trying to find a middle ground. Don't go down too many rabbit holes with all the conspiracy theories and things like that. Just, kind of take it as it comes and find a few reliable sources of information and go with them.
Okay, I think that's very good information. And leading to that, you were kind of became Mr. Popular with your daily dose of calm. So shout out and a big thank you for that, because I think everyone needed that during the time, especially when did you probably start that? Mid-March?
Yeah, it was actually right when it first started hitting the United States, and some places were declaring public health emergencies, and they didn't have
Mhm.
any cases yet. And I noticed a lot of people on social media were just throwing a fit. They're like, "Why would they do that?" And I was trying to explain that was just a way to access federal funds, and try to make sense of it. And I just called it the daily dose of calm. And then it was like the next day something else came up, and I was like, "Hey, it looks like we need another daily dose of calm." And so I explained it, and then like day three, I had no plans of this being a thing. And day three, somebody's like, "Hey man, where's our daily dose now?" And people started asking for it. And so I started doing it day in, day out and everything. So
Are we going to see this again soon? Like, are we going to get a monthly daily dose? Is this going to be a regular thing, or is it going to be put to bed with that
I
with
think
number
we'll do them
50 again?
periodically. I think towards the end of it, like once we started reopening, there were a couple days where I was like, all right, like really trying to think of something to write about. And I was like,
Yeah.
then it becomes about getting attention and not just like, informing people. And I was like, that's probably a good time to stop. And I looked at it, it was like the 50th episode. I'm like, perfect, time to shut her down. And I will
Really.
probably update, especially if anything comes up where I feel like we need to update anybody. So, I'm not saying it'll never come back again, but I don't think it'll be a daily dose anymore.
All right, we'll be like a monthly, annually, whatever we got there. So, just a
Right.
little shout out for the community. So, like, from your position, what can we all do to help with this and moving forward? Anything out there that we can do?
Well, there's a lot of things. The one thing I will say is the stay-at-home order and the quarantine wasn't a benign thing. I mean, a lot of people saw from a mental health side of things, a lot of people had major issues there. Our overdoses in the county went back up. I mean, our small businesses took it on the chin hard. And so try to get out there, and as you are opening back up, support those, especially those that you saw supporting the community, during its toughest time. So really encourage you to patronize those businesses. And then also, it gave us an awareness of a lot of people in our community who may need some extra help.
Mhm.
You saw people volunteering for elderly people to go get their groceries and just doing things like that to protect them. And I think, just that general sense of community, I would like to see us continue that forward. And just it slowed down our pace of life and gave us more focus on our family and things. And I think maintaining some of that as we reopen is just really important for our own personal health and mental health. So.
I would agree with that. This has all been great information, and I appreciate you taking the time as you were running errands in your car. I'm wondering how many people are walking by being like, "What is he doing?"
Well, I'm never in one place long enough, so this was perfect. I'm like, let's just pop it right here and do it. So,
I love it. So, thank you so much for your time. I appreciate it.
thank you for having me.
All right, we'll talk soon. See
All
ya.
right, take care.
Bye bye.